Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callendar.
But anyway, it's interesting though that they talk about the real risk is not so much the flying, but getting to the plane. You're getting away from the plane. That's where you run into all kinds of people and all kinds of situations. And social distancing is kind of difficult on those lines.
Yeah, I'm wondering how they could track anybody. You know, so many people travel. How would they, trace, what do you call it?
Yeah,
Contact tracing for
yeah.
plane travel? That's got to be a nightmare.
Yeah, because you go so many different places on the way to the plane. And,
Changing flights?
not necessarily changing flights. Going to the, you got to get first. You go, you get the ticket. You go stand in line. Then you go through the getting your bags and everything, and then you walk. You're transported one way or the other through the rest of the station. And it depends on how big a station it is. And for many of the stations, you have to go a long distance. Sometimes, like in Nashville's not too bad, but it's still, some places it's long distances. So you come in contact with a lot of people before you even get to the plane. So being on the plane isn't the lone source. It's everything you come in contact with before you get to the airplane itself, standing in the lines, all that. So.
I was just thinking that they would screen everybody coming into the airport.
But screen only means that they find if you have a fever. That's
right. That would be a disaster too, because it would take up so much time.
I believe they do that in some locations. They do check your temperature, but I mean, that doesn't mean much if you're taking Tylenol. So. But they are doing that to some extent. But that's not the real test.
Has anybody here been on a plane since the thing happened?
I haven't.
No.
Nope. No.
I understand that they're training dogs now to pick up whether or not someone has COVID.
Yeah.
That's interesting. Yeah.
Mm-hmm.
Okay.
Hey, that doesn't sound right. Of a dog, what are they doing? Sniffing out?
Yeah.
Yeah.
Do that anyway. So, but I don't know if they finished the training process. But anyway.
I don't think so. I think it's still in a testing phase.
Oh, I see. Now, I think we all know that eating indoors in a restaurant is dangerous.
Yeah.
And while people have masks before they eat, they can't have masks while they eat. So,
Right.
And most people are talking while they're eating, so that's spreading also.
Yeah.
That's some other. Now, of course, restaurants open and many places movies open. So who would dare to go to a movie? Well, I guess like going to church, I guess. Huh? Recently, they've been talking about the problems in the DC with people being honest with contact tracing, because sometimes they're not willing to so-called rat on their friends, and that's becoming an issue with contact tracing. We're suspicious anyway, and because you're paranoid, so it becomes another issue. In DC, they've talked about the fact that some of the people are not willing to talk about where they've been and who they've been in contact with.
There you go. I mean, a lot of people uh, do not want for anybody to know where they just came from.
Yeah, you're right.
Yeah.
And then if you tell on somebody, then they're gonna go to them.
Yeah.
And they know it came from you.
Right.
Oh yeah. JB said he was over John Tatum's house. So what were y'all
That's-
doing over there? Okay.
That's right. Yeah. Yeah. So it's interesting how this 6 months and the next 6 months are going to be.
Yeah. Yeah.
I think it's going to be the next 12 months.
Well, this next 6 months will be very interesting, as will be the 6 months thereafter. The next 6 months may be interesting because we may have a vaccine, but that still remains to be seen. Foods that fight memory loss. This is an interesting article that talks about those foods that prevent you from having cognitive decline and those that accentuate cognitive decline.
What about jellyfish?
I don't know. Well, they talk about fish. They don't specify jellyfish. They talk about fresh fish.
There's a medicine, I guess I don't know what you call it, a supplement it comes from jellyfish. They've been advertising a lot.
Oh, I see.
And they've been using it for years, and people will say, yeah, my memory came back. I'm doing a lot better. I'm sharper.
Yeah.
Jellyfish.
Yeah, they have that and other medication that they allege. They even, as a matter of fact, I got a call about Armistead, which is a medicine that's allegedly good for it. Although most of the studies don't back it up. But then green leafy vegetables, they're good for almost everything, I guess. I guess the worse they taste, the better they are.
Oh,
But I guess most of us like collard greens and spinach, huh?
Yep.
love spinach.
Yeah.
How about kale? You like kale too?
I don't like it.
Yeah.
I never buy it or eat it, but I like it.
So they're suggesting one serving every day, and other vegetables, they give you a range of, it's interesting that one of the better vegetables that we have, I don't even think is in here, and that is sweet potatoes.
Oh, yeah.
Yes.
Doc, what about Brussels sprouts? I hate Brussels sprouts.
They're good. They're good. Yeah.
They're good for you? Probably.
Yeah, they're very good for you. I hate it too. California, that's all you have.
Brussels sprouts.
Brussels sprouts. That's like apples. But look at the range of vegetables they talk about,
Yeah.
Even corn, which is nothing. I mean, it goes in and comes out untouched.
Right.
But anyway, yeah. And then, of course, nuts.
Oh, yeah.
Nuts, especially walnuts, they talk about. And then, of course, the blueberries and strawberries are good. And then, of course, Darryl and the beans. Darryl's always talking about the beans, and they are particularly good for you. Darryl, any comment about that? The
About
beans?
everything.
With everything.
Well, I just always make exceptions for the hybrid foods like spinach.
Oh,
Okay.
no.
Would avoid those.
Whole
Spinach.
grains, back to that.
Yeah.
What is the best source of whole grains? Darryl, any ideas and thoughts about that?
Yeah, avoid the process. Anything that's white flour. Well, of course, white flour is never going to be in whole grain. Wheat is a hybrid, so if you can substitute that with spelt flour, you're better off. but it's spelt would be a whole grain. Spelt and flax are both whole grains.
Fish, it's interesting that what surprised me about that is that they said you only have to eat fish one fish meal a week. And then they emphasized that it shouldn't be battered, dipped, or fried fish. Sometimes we think fried fish is good, but the fresh fish are what they suggest.
Is it any fish better than the other?
Yeah, they talk about salmon, and they talk about what's some other fishes?
Trout, rainbow trout especially.
Yeah, trout and tuna. Yeah, those three they talk about more than any others that are supposed to be good.
Yeah, avoid farm-raised fish because they're full of hormones and antibiotics.
Yeah, are they required to indicate if it's farm
Yeah.
raised?
Yes. Also, the tuna, there's concern with mercury because they, being a high order predator, they seem to concentrate mercury.
Yeah, well, yeah, all of those, yeah, that is a side effect. Poultry. So winter chicken dinner, huh? Is it good? So just eating chicken or turkey at least twice a week. And fried chicken and chicken nuggets don't count.
So I qualify for fish and poultry. That's all I eat basically, except for Sunday.
What do you do on Sunday?
Breakfast.
Oh, okay.
Bacon and eggs and sausage and cheese. Once a week. Once a week.
We're old enough to remember chicken of our childhood. It's not nearly as big of chicken as chicken of today. With all the bad stuff.
Olive oil has been linked to this, and a lot of people, everything they cook is in olive oil.
That's what I use to cook.
Yeah. Then, of course, this is one of the interesting wine, but they emphasize that only 1 glass of wine per day. But wine apparently is very good for the brain. It helps the brain eliminate waste.
Got a question about that. Why wouldn't grape juice be as effective as wine, except for the sugar part? Why does it have to be alcohol based?
I can't answer that question. Any ideas?
Yeah, alcohol has no benefit. You go with the grape juice. And anything, when it talks about juice, it usually has sugar added. Or, of course, the sugar isn't a good thing for you. If you just want to get down to the source, eat grapes.
Sounds good to me. I love grapes.
Doesn't the wine come from grapes?
Yes.
Yes. Yeah.
Now, this you're not going to like this one. What to avoid? The 10 foods that you need to avoid. The red meat, butter, and stick margarine, cheese.
Oh no!
Pastries, sweets.
Oh no! Oh no!
Fried or fast food.
Oh my
It's
goodness.
everything.
That's the best part of the food. Oh.
That's my diet right there.
It tells both sides of the story, so that's all you can ask.
I avoid that whole list. I'm good.
Yeah.
My
Okay.
goodness. Moving right along.
Now I wonder how. Well, of course, there's an article that they changed their minds, but remember that they said you don't need to get tested if you're asymptomatic.
Yeah. Yeah.
And now he says 40 to 45% of infections are asymptomatic, which makes you wonder about CDC.
Absolutely. They've been having so many changes.
I know.
I
Yeah.
hate to say it, but it's proving what Trump is saying, and I don't want to say that. But Fauci and others, CDC, they've reneged on a couple of things recently.
Yeah.
Not Fauci.
Not Fauci, right? CDC.
CDC, yeah.
Yeah.
CDC has been embarrassing.
Oh, yeah.
Yes.
Aren't they controlled by the president?
I think so.
Yeah. Yeah.
Yeah, they're getting a lot of pressure to
Yeah.
The
to
White
do
House.
what he
Well, no,
wants.
the way they say it, not the president, the White House.
Oh, mm, mm, mm.
Yeah.
Hey, Dr. Callendar, we
Yes.
got a special guest on the line. His name is Rodney Stepp, and that's our cousin from Indianapolis who contracted COVID-19 and
Oh,
survived. And if he would not mind unmuting and greeting everyone.
Well, good morning, everyone.
good
Good
morning.
morning.
Good
Morning.
morning.
Welcome.
Thank you. So it's definitely a blessed morning. As I'm sitting here dialysizing now, if that's a word.
Wow. Well, you know, Darryl's a tenor, so we just got the bass.
That's
You're doing home dialysis?
that's my early morning voice.
Oh,
Are you doing home dialysis? Is that what you're
Yes, I'm doing PD now. Yes.
doing? Okay. Mhm.
After this is my third full week of PD.
Mhm.
And
Oh, I see.
lost use of my kidneys during COVID. I was
Oh.
intubated for 14 days
oh, wow.
and in the hospital 41 days.
Oh,
I was
wow.
one of the first major cases here in Indiana, and they're calling me the miracle patient of IU Health North. They didn't expect me to really make it, and but God had other plans. So, and
What a blessing.
I've been trying to get on this Zoom call for several weeks here since Darryl invited me, and I thank you guys. But and thanks, John, for the introduction.
Okay.
Yeah, as a matter of fact, because Darryl had mentioned your case, and it's nice to hear how you've survived and managed to be able to dialysis. Do the doctors expect your kidney function to return, or what's the expectation?
You know, that's the 50-50 question right now. Everyone has hope, you know, and I have hope as well. But right now they're not budging very well. My creatinine level is still high, and so, you know, but I am still urinating.
That's a good
you
thing.
know, which is a good positive sign. And I'm beginning to urinate even a little more frequently on my own. So,
Dr. Callendar.
you know.
It's interesting that he says he's still urinating. I always thought with losing the function of your kidneys and being dialyzed that you're not able to urinate.
It varies. Some people.
I told you about my sister's friend, and he's now on the transplant list. And remember I mentioned the fistula, and he did get it. But prior to that, they did have to put the port in, and they were using that. And I think today they're going to start with the fistula. However, he urinates all the time.
Yeah, well, it varies from patient to patient. And the longer you're on dialysis, the more likely you are to not make urine. But it varies very much.
Well, I'm glad you're doing well, sir.
Yeah, we're thrilled to have you.
It's a blessing to just still be here.
Yeah, we're thrilled to have you.
And I'm sorry, I had to get on my phone so I could to join in, and I don't know, my camera doesn't seem to be working. So
it's
sorry.
working.
Oh, you can see me?
Yeah, it works good.
Yeah.
Oh, okay. Well, yeah, well, you can see what I'm doing here. I'm doing this dialysis. So, well, thanks. It's a pleasure meeting everyone, and I'll just listen in and try to learn something here.
And contribute whenever you feel it's appropriate.
All right.
It's good to see you having such a positive attitude. That makes a big difference.
Yes, it
does.
does.
It
Yes,
does.
it does. And
Yeah.
Yeah.
I just think about, the blessing of still being here. And so, hey, and at least I have my music, right, Darryl and John?
Abs-
And
Absolutely.
Rodney, John Buchanan is also a musician.
Hi, Carol.
Hi, Rodney. And
Love-
Dr. Callendar is also a musician. He sings.
Oh, that's awesome. Uh, Well, I guess we can just have a Zoom recording session there.
Yeah, we could.
If only somebody would listen. Uh,
And,
But it's interesting how in Europe they are having a upsurge of the virus,
Yeah.
especially in UK and other European countries. So we're not alone in having. And then of course, I guess after the Labor Day, we can things spiked again in a number of places. And here's the dreaded thing about choir practice. 87% of the 61 people rehearsing. That's not fun, but anyway. For those who want to start choir practice again, that's kind of a warning. Anybody think that? Did you hear the latest battle with the president about the FDA is talking about having tighter restrictions for the vaccine, and Trump is opposing it?
Yeah.
tighter restrictions in what way, Doc?
In other words, they may be upping the requirement. Right now, if 50% of the people who get the vaccine have antibodies, that may have been adequate in the past. And so they're talking about increasing that. And Trump is opposing it because who knows why. But anyway, he's opposing it. You could think that it may have something to do with the vaccine coming out before the November election, but we can't speak for him why he's opposing it, FDA having tighter restrictions. Yeah, they should have.
I was thinking that they said that they were going to prioritize the recipients of the vaccine
Right.
with first responders first. So the general public would not be getting it. And then
Until later on, yeah.
Yeah. Then after that, the people who are most at risk, like Black and pre-existing conditions and elderly. So
Right.
the general population wouldn't get it until later.
Right.
My question sort of is, okay, so if they start doing this, say in December, it's going to take another 2 or 3 weeks to get that second dose, right? So they're still talking about 2 doses.
Well, remember, there's one vaccine that only requires 1 dose. So it depends which vaccine comes out.
Oh,
The vaccine that is at the forefront right now requires 2 doses, but there's a vaccine that only requires 1 dose. So it all depends on which of these vaccines become available first.
I think that's the one I want.
Dr. Callendar, is there any way that they can test the strength of your antibodies for COVID?
Yeah. Yes, they do it all the time. That's why they do antibody tests.
Mhm.
For example, all of us at Howard had antibody tests, so that they can do it. They can do first test to see if you have antibodies, then they can test to see the strength of your antibodies.
Okay.
And
that's, for example, that's how they get plasma and use it for treatment, because they find those people who have high antibody titers, and they treat people with that.
So
that's a blood test, right?
Yes, that's blood.
So what about Rodney? Will he be on the list to get the vaccine? High on the list.
It's interesting because he would likely have antibodies already. And so, of course, if he has age and renal disease, would make him higher, a priority on the list. Yeah.
Okay.
Only question is, does he already have antibodies anyway?
Mm.
And how long do the antibodies last? We don't know the answers to those. This article was a little not surprising, but nonetheless worthy of looking at, the fact that it's more likely to kill minority children as well as it does adults. It's interesting, 3 out of the 4 that died were Hispanic, Black Americans, or Native Americans. You know, when they talk about Native Americans, they often don't talk about Alaskan natives, and I wondered why, because they're in the same category in many ways, except that. But anyway, they generally don't talk about Alaskan natives. But anyway, I think this is should be scary to parents who have their children going to school. At least minority parents who have their children.
And scary for the teachers.
Well, that already is scary.
Yeah.
So that is automatically scary. But because yeah, that's the group that is likely to become affected by the disease and even killed. But the kids have a better tolerance for it, and they rarely have severe infections and die. But for us minority parents, then that's really scary.
Dr. Callendar, you just mentioned about Native Americans, Native Alaskans. What about Hawaii or anybody that was born in the land even after America has acquired them?
That's an interesting point, because we had a MOTAP chapter out there, and they aren't even addressed at all. They're Asian Pacific Islanders, and Asian Pacific Islanders in general have not been in the high risk group. So if they fit, and they do fit into that category, so it appears as though Asians, at least the ethnic group we call Asians, are not in the high risk group. It's an interesting graphic here, and it shows that Asians and those are not likely to die in this one, but Hispanics and Blacks. With Hispanics, what is interesting is that Hispanics are almost twice as high as Blacks, and it's far higher than any other group. And I think that is alarming to see them so much higher than any other group.
This is just dealing with children, though, right?
Yes.
Okay.
Just dealing with children. Yeah. Yeah. You know, we learn so much. We learn how ignorant we are about the disease, and as time goes on, we learn more and more.
But you have parents protesting to get their children back in school.
Say what again?
I said that you have parents protesting to get the children back in school.
Yeah, I know. That's what's interesting. Yeah, I say, and they send their kids out with protest signs.
But they want the kids to go back to school so they can go back to work.
That's what it's all about. Yeah.
And Trump wants them to go back to work. So
yeah.
get those kids back in school. Then all the teachers will die off. Oh boy. Oh,
well.
boy.
Then they be right back where they started.
There you go.
Community teachers in the schools.
Well, you know, DC is supposed to start back in November.
Yeah, that's right. Yeah. Which is going to be interesting. And I think that's because the number of cases in DC have dropped off, and the deaths have decreased. Now, this is an interesting article about vitamin D. We've had a number of discussions about vitamin D over the last month or so. And this is an article that talks about people with dark skin versus people with light skin. And
So I just wanted to clarify, Doc, this is synthesized from that big report that Tatum sent out from the NIH about vitamin D. So this is just a small part of the article. I think it was like 28 pages or something
60.
like that. 60 pages. 60 pages. Yeah, it's huge.
Yeah.
And,
but you know,
it's the part dealing with us.
right. And one of the things about it, and of course we don't know at all how this relates to COVID, and I think that remains to be seen, and then it will have to be this. But I think this is a good way of looking at. Now, somebody had asked about the level, and I think the level is 30, and so if you're less than 30, you do need to take supplements because low vitamin D levels are associated with diseases, and kidney disease is one of them, and some others. But as you said, there's a lot of debate and discussion about that. But this is interesting to show why our parents were giving us that cod liver oil, no?
Oh yeah.
Which we hated. I hated cod liver.
I kind of liked it myself. It was so nasty. It was good.
How can you like cod liver oil?
I look forward to getting it. I don't know why.
Really? Anybody else like cod liver oil?
No.
I hated it.
Yeah, me too.
But there was no escaping it.
That's right.
I know.
Remember sardines? Anybody ever have sardines?
Oh yeah, I like them too.
Yeah, and then tuna fish. Those were the cheap things. You could get sardines and tuna. Yeah.
Was this, we could download this? I didn't get all of that.
Well, ask your husband.
Okay.
Oh, yeah.
No, I mean,
Yeah.
John Buchanan, when you had it on your list,
Mm-hmm.
I downloaded. I didn't get this chart and everything.
Really?
Bring it to us.
Yes, in there.
Yes, in there. It is.
I'll look back through it again.
Because I got it.
The way the first thing that your husband sent out was a 60-page article.
Oh, that one. That's different.
Yeah,
I know, I didn't read that because I don't like to read because I'm black.
it was.
Oh,
Oh no, but yeah. So this I sent this out about a week later, I think. Well, a few days later. Exactly.
Oh, okay. And
oh yeah, yeah. You sent it out last week.
Mm-hmm.
Dr. Callendar, do most physicians know about this? Because my
Yes.
physician doesn't seem to know about this,
Know about what? What are you speaking of?
about the supplements, because he said that I needed 5,000.
It depends what your vitamin D level is.
Okay.
And
But,
if you have a low vitamin D level,
and I thought that walking and all of that and getting the sunlight every day, I shouldn't have been that deficient. But anyway.
well, you look at your level and see what it is. If it's less than 30, most physicians would suggest that you need supplement. But if you're at 30 or above, you don't need anything. And as you noticed from the article we discussed before, it's still very controversial as to whether or not blacks need supplements.
You know,
But I think the medical position is that if you're vitamin D deficient, that the safer part of it is to at least be at the low and normal level. The problem with vitamin D, as you see later, we have a paper on that, is that it has its problems and it causes a number of complications that need to be avoided. So, yeah, that's right. That's too much of the vitamin is very detrimental. So you have to have a balance. And you have to,
Okay, that's the one I'm talking about. Okay.
oh, that's one you, okay. Yeah, that's a different one.
So you shouldn't take Dr. Callendar. So you shouldn't take a lot of supplements. I have a problem with my vitamin D level, and they said 30 is low. I'm
Yeah,
at 20.
that's the lower level of normal. 30
Yeah.
is normal, but that's the lower
And I'm
level.
at 25, so I'm a little
No,
below
you're low.
normal.
Yeah,
And
you're low.
I take D3, and it'll creep up, and it's tested once a year. But this year I'm back down to 25. And so the doctor said, we're not going to worry about it. Of course, they talked too about the sunlight. They said early morning sun, and usually I'll walk early in the morning. And that morning sun, they said, is very good for vitamin D. And I take that Citrical D3, but it doesn't it doesn't move very high, the levels.
I had a question about that too, Doc. You know, Darryl was saying that Black people don't need vitamin D, and I'm questioning not the general idea, but the fact that each one of us is not 100% African. You know, that might be accurate for you know, Native Africans, but when you come over here and you get mixed up with some other, you know, racial groups, none of us, I don't think, is 100% African. Just like we were talking about sunburn. You know, a lot of Black people don't ever use sunscreen. I do because I get sunburn.
That's you're
And
smart.
my grandmother was this color, for real. You know, for real. This is her complexion, and my grandfather was this complexion, right? So in between those two, I guess I got the part that's sensitive to ultraviolet, and if I don't put sunscreen on, it's painful, and you know. And I heard that too when I was growing up. Yeah, Black people don't need sunscreen.
Oh, they do. That's not true.
But as a
I
diver,
say some don't.
yeah,
But we burn just like, we don't burn as much as they do, but we burn as well. And one of my most interesting observations when I went to Africa was that the whites were putting on sunscreen to keep from being burned, and the blacks were putting on whitening cream so they could turn white. So, so no one is happy with what they got. But I think my opinion on it is that if you have a low vitamin D level, you probably ought to take a supplement. If you're at 30 or above, you probably don't need anything other than sunlight, because that's the normal level. But as the article we discussed about 2 weeks ago identifies, that it's different for people of darker hue, so that one size does not fit all, and that there's much evidence that suggests that many of the Black people don't need to take supplements. But I think the biggest problem is having too much vitamin D. That is a big problem. So
Doc,
Do white physicians and Asian physicians know this fact?
know what?
Know that Black people are different as far as vitamin D?
I don't know what others know, because I don't know about that. But I think the evidence, I mean, for example, the discussions that we looked at 2 weeks ago is common knowledge. And here's the other thing: there was no real conclusion that this must be done this way. We just recognize that things are different, and we still feel that if you have vitamin D deficient, you should take some supplements. That's if you're vitamin D deficient, and the amount you take should be limited, because we know that vitamin D is toxic, and it's probably more toxic to us than it is to any other ethnic group.
so Doc, does a regular physical, and when you get your blood tested, do they test for vitamin D? I've never seen that.
They should for African Americans, because it seems as though we are more likely to be vitamin D deficient.
Yeah, the vitamin D testing, that's a standard part of annual physical blood work.
The vitamin D, I've never
Yeah.
seen it.
Well, it depends. I guess in Chicago it is. It may, a good physician would do it, but I don't know that everyone does it. They should do it. But I think Darryl is right. It should be part of your annual. Of course, we now know that the annual is it varies on who you go to, and because we also know that the government doesn't pay for the annual physical. So that's another issue we have to talk about in our app, the fact that, and we did, but somehow I didn't see it, and there's some aspects of the app that we have to look at, because I think some things are missing from it. But that discussion about the fact that the annual exam does not include physical, does not pay for physical.
Okay.
Any other question? Because I think this is a very debatable issue in terms of whether or not you should take vitamin D or not. I personally believe that if you're deficient, that you probably should take a supplement. How much of the supplement is another question, because since vitamin D is toxic to us, we shouldn't overdo it. Yeah.
My question is, we talked about the low level being around 30.
Now, the normal level is 30.
Yeah, okay. So now, Carol's doctor, I don't know if she said this or not, because I saw an article which said that if you've got to go up to 4,000 units or 5,000 units, then you need to supplement with your diet, because 5,000 international units is too much. Causes problems and illnesses.
Yeah, that's right. No debate on that.
The article I sent a couple of weeks ago said that with Black Americans, 2,000 units or more supplement increase all mortality rates and likelihood of osteomalacia, bone softening, or rickets. And so and also it raised risk of cardiovascular accidents among Black Americans, but they don't have enough studies to say what is a good level of vitamin D for Black Americans. So it just hasn't been studied.
That's right.
That would be interesting. I have some friends, and everybody thinks they're a doctor. And now with COVID, I have some friends that read up on it all the time. And Janice, you need to take 2 to 3 vitamin D pills every day, because me and my husband do it all the time. There's a limit. You just don't keep, I don't like taking a bunch of pills. I really
It's dangerous.
don't. I do take vitamin D level, but I'm not going to double my dosage.
No.
Is there a max? When is it really toxic, and what's toxic?
Oh, well, that's what this article is about. This article indicates that too much vitamin D causes problems, including, as Darryl said, cancer and other things, and increases mortality. So that I think you should take supplement that allows you to get close to 30, if possible. But following your friend's advice would be a mistake.
Right.
The other, I think the article said, Dr. Callendar, was that, you try to supplement vitamin D with your diet. That's very important.
Well, I think you should do both. And if you can, and if you recognize the things that increase vitamin D, that's why that table on the last slide was so important. And if you eat more of those things, you would find that you would need less vitamin D supplement. Probably.
Did anyone give any feedback on the vitamin D article that was 61 pages? Any feedback from that?
Yeah, we just saw that, John. I guess you must have been on the phone.
Yeah, you probably were on the phone. We talked about it. Yeah, so that basically, as I said, it's still debatable. As Darryl said appropriately, they haven't done as many studies with us as they've done with white folks. And so some of the answers remain to be seen. We know that we tolerate low vitamin D levels better than other ethnic groups. We also do not tolerate high vitamin D levels. So you really need to be mindful of the fact that vitamin D supplements are toxic. And so taking more than 5,000 units, international units, is not wise, especially not for us.
Dr. Callendar, I have a question if you don't mind.
Oh, that's what we're here for.
Okay. With the, because I'm a newcomer, so to speak, to the dialysis world, I know that they have mentioned to me my protein level of keeping the dialysis takes away a lot of your protein. My problem is with COVID, I have found that one, I still have a loss of appetite. Two, I don't have, I have a big loss of taste. And then now with filling my membranes up with 2.5 liters every time I dialysize, I just don't have any room for a lot of food and stuff. So what do you suggest in order for me to, is like the protein drinks or the protein snacks enough if I just don't want to consume a lot of food?
I think the protein supplements are good in terms of getting you to the protein level that you need to have. Yes, I think there's a place for protein supplements, and they have a number of them that, do you have any taste at all?
Yes, I do have taste. It's just not, it's very bland. I mean, it's extremely bland.
Yeah. Yeah, well, I think those protein supplements would be helpful for you.
Thank you.
Let me ask
Absolutely.
you, are we talking about things like Ensure?
Yes.
Ensure.
Yes. Things like that. Yes. That's a protein supplement.
Yeah, I used to like Ensure, because of the way to get some vitamins in you, appetite low.
Well, it becomes a special problem when you don't have much taste, and that's what happens with COVID and other viruses.
That's
You
why
take away your taste.
That's why when I drank that Ensure, I would get chocolate, I'd get vanilla, I'd get sugar.
Yeah, they have been supplying me with a drink called Nova. It's supposed to be for renal patients.
Yeah.
And then of course I like the Ensure chocolate. So between the two of those, and then these little bars that they've been giving me, to try to get my protein levels to stay up. So, hopefully, prayerfully, these kidneys will come back. But
Dr. Callendar, my question is, I thought when you have COVID-19, okay, you lose your sense of smell and taste, so they say. I thought after you got through with your episode, it returned. That means you lose it permanently, or what?
Some people, it varies from patient to patient. Some patients have it returned promptly, and some people never have it returned. Now, I've got to understand that we've only been dealing with this disease for less than a year. So we don't know what never really means. So it may well come back after that. But there's a number of patients who have long delay before the taste return. By the way, are you on peritoneal dialysis, Rodney?
Yes, I just started. Like I said, I think this is my third full week of ED.
Yeah. Well, that's the best. That's one of the best types of dialysis, peritoneal dialysis.
That's what they kept telling me, and that's and I've been very aggressive of trying to get through this thing. So I was all ready for it. I'm ready for a transplant. Let's go.
Well, give it a chance. Give it time, because it is clear that peritoneal dialysis is one of the best types of dialysis, because it gets you closer to normal than actually hemodialysis.
Well,
But of course, it has its ups and downs as well. Of the-
Rodney, I think a couple other people that are on this are also on dialysis.
Yeah, by the way, we haven't seen Kevin in a while. How is he doing?
I think, okay.
He doesn't have a computer, but he uses his mother's computer. So Carol's going to get in touch with Miss Reese and see if they can get back on.
Yeah, because we miss him. He was on peritoneal dialysis for years. And he did pretty well with it. Of course, he's just got a transplant about what is about 8 or 9 months ago.
Mhm.
Yeah.
Yeah.
Rodney,
How,
I have a question.
Tatum, how long were you on dialysis for?
Who?
How long were you on hemodialysis?
Me, I was on dialysis 2 times. The first time was 4 years, and the second time was 3 years.
Okay, so you're an expert on hemodialysis then. Huh?
Yep, I was getting ready for home dialysis, but just when they brought the equipment to the house, I got another call for a transplant.
And is Carol ever happy?
We got Cheryl and Pearline, both are on.
Oh, good.
They're on
Okay.
the line.
Yeah, I'm on. Yeah, I'm on dialysis.
Yeah. How are things going with you,
Chemo.
Pearline?
Chemo. Well, I've been ripping and running and working as well, but I'm doing good.
Glad to hear that.
I'm
Glad to hear that.
adjusting, but I'm still waiting for a transplant.
Good. Are you on the list yet?
This is the funniest thing. I've done all my tests and I haven't heard from the team. So I'm gonna give them a call and find out what's going on.
Please do. Right. You remember our history.
Mm-hmm.
Yeah. So.
Yeah.
Okay. Now this is just as we now move to another era in the practice of medicine. Telehealth services now with us. Seems like it's good, and it's important. This is an article that talks about tips to better improve the telehealth visit, and it's from many perspectives, the physician-patient perspective.
I'm hearing some machine noise. Somebody may need to mute.
Well, they heard you, so they muted it. Okay. Start it again.
I
Yeah.
know. Who is it?
John Buchanan. It's mine.
Oh, okay.
So now this is what is interesting about it is that sometimes you forget that you have to dress professionally for the visit. So the doctor has to look like the doctor. So the other thing, of course, is that now that it's interesting they talk about it. It's just like you're going to be on TV. So you use the kind of colors that are friendly. They talk about putting your patient at ease. And have any of you had some of these telehealth calls or visits? Yeah.
Yeah, I did.
Mm-hmm.
Mhm.
What do you
Yes.
think about these points that they're making?
Yeah, they're very nice, very good. I like them.
Okay.
I haven't had any.
My telehealth visit was pretty flawless. It was it's kind of complex. Kaiser has their own proprietary telecommunication with the doctor and the patient. I got on Zoom with my wife and got her to. Yeah, I shared my screen from my doctor, so my wife could actually be on the call as well. So that's a whole nother level. Is possible with telehealth.
Yeah.
That's good because Dr. Callendar always says that it's good to go to a doctor's visit with your spouse. you know.
Yeah.
Significant other, right?
I'll go with spouse.
That's because you have a spouse. Yeah, okay. Now, this is something that may be hard to do, just in note taking for health visits, because you remember how patients don't particularly like it when you're looking at your computer instead of them. And so if you're taking too many notes on a computer, then you have to be careful and know how to do that, and not make the patient feel as though they're an outsider. Yeah. Now, this, of course, would be ideal, because I think that very few patients actually ask all the questions they want. And after they leave, they go and ask somebody else, well, what did the doctor say? And at the end of the visit, you should review and make sure that you are together on the treatment plan. It's very important for both sides. For the doctor to give you a chance to do it, and then also for you to understand everything.
Dr. Callendar, I have a question about what they dress. When you started, every physician had to wear a white coat, right?
Yes.
Okay, when did that change? Because I know one time when I went with my sister-in-law, and he just came out in his regular clothes, casual, and I was saying, wow, it just seems so different.
I'd never seen that.
Okay, well, remember that position she was going to? Somehow miraculously he's not working anymore. But anyway, that we know of. I was just wondering, do the modern physicians or the ones that are just getting out of medical school, do they not wear lab coats or the white coat, or?
We wear white coats.
Okay.
Always.
Because I was
They're trained to wear white coats.
Even the white ones? Even white doctors?
Yes.
Doctors of all ethnicity.
Okay. So when this doctor didn't wear his white lab coat, he was just being
Iconoclastic. He's different, right? And that's not the normal way we do it. So.
Dr. Callendar, I remember when doctors used to wear the white coat, yes, lab coat every time. But now I didn't see them in jeans now, 40 years ago. Now I see a lot of them wearing jeans.
Well, if you have a white coat, people may not notice the jeans. But as a matter of fact, the white coat is supposed to get you to focus on the coat and not see the jeans. So we don't talk so much about what you wear under the white coat, but we do talk about the fact that you wear one.
Doctors wear a fresh white coat every day?
It doesn't have to be the fresh new white coat, but it should be a white coat. And it would be ideal to do a fresh new one, but it's not always, because theoretically you may wear that white coat whenever you go to see patients.
Have you ever heard the expression, the white coats are coming?
Yep.
Red coats.
Now nurses, and I know we got 2 or 3 nurses on here, they've changed their outfits, because it used to be in the 40s and 50s, maybe 60s, nurses wore all white.
Right, right.
And now, when did the nurses change?
Yes,
Well,
yes.
any comments from the nurses on board?
Yeah, when I graduated from nursing school in 1968, I mean, we had to wear caps, white dress, no earrings, just the wedding ring. And it was very strict, hair all the way up like buns. But then through the years, late 70s and all that, it started changing, and now they wear scrubs. We weren't allowed to wear scrubs. And I don't know what they do on the wards, because I worked only in intensive care unit and dialysis. In dialysis, we have to wear scrubs. So I'm not sure what they do on the wards.
Oh, by the way,
I teach. I work for IU Health North as well. I'm a simulation technician, and we teach first, second, and third year med students. We teach and test. And what has happened with dress code basically is depending upon the department you work in, like in Indiana, you'll see most of the nurses wearing red. They'll wear red or they'll wear blue. If you're working in an operating room, like you said, they'll be wearing scrubs. They'll wear blue scrubs, or nurses on the floor will be in red or even sometime yellow. They have, again, it depends on if you're working in ICU or PCU or this and that. It just depends on where you work. But everyone is supposed to be in uniform, and everyone is always supposed to have an ID, a visible ID. Those are the two things in the medical field now that are mandatory.
Yep, that's right. By the way, Dr. John Robinson had to go back to the hospital.
Oh,
Oh,
my
And
goodness.
so he's told me to greet the group for him. He's back in Washington Hospital Center now. Apparently he didn't thrive at home. But he come back to the hospital. So keep him in your prayers.
yes.
Back to
Okay.
the lab coat, if you were it a second day, is that potentially a health risk to either patients or the doctor?
Lab coat?
Say again, Darryl.
If you wear that white lab coat the second day, is that potentially a health risk to either the doctor or patients, that coat?
It may be a risk to the patients. Yeah, it may be. You're right. Good point. And I'm not, especially in this day and age now.
It's a fomite.
I don't think there's any debate about that. Yeah, I think you're right. Comment about this. There's an article in 3 weeks ago in the newspaper that talked about wearing masks and how you can avoid some of the side effects of your glasses being blurry, those kinds of things. And so some people don't like to wear masks, and some have good reasons for it. They can't breathe with it. And but masks are thought to be the best way to do it. Shields are good also, because most people forget that you can detect virus through your eyes. And there was a study that evaluated the ability to get COVID-19, people who wear glasses and people who don't wear glasses. And they found that the incidence is much lower in those people who wore glasses. And so, which fits in with the principle that we had in the operating room, where we wore shield and masks. But many people don't realize that the ACE2 receptors are in the eyes, and so therefore the eyes, as well as the respiratory tract, is a source for transmitting COVID.
Sorry, Dr. Callendar. I'd like to thank everyone for inviting me to this, and Darryl for sending me the link and inviting me to this meeting. Unfortunately, I have to go to a dialysis clinic, and I need to go get ready for that. So I have to be there about 11 o'clock. So I definitely will, join in. I've learned a lot this day. So I'm glad that I was able to participate this morning.
Well, come back again anytime. We'd love to have you.
Well,
Rodney, can you put your email in the chat, and we'll send you all of the articles.
Oh, sure, no problem at all.
Okay.
All right. Well, thank you very much, and everyone have a blessed day as well.
You too.
Thank
Thank you, Rod.
Thank you.
Thank you.
John Tatum, did you have a brother named Rodney as well as I did?
Yes, we did.
Wow. So that's,
Really?
Yeah.
How about that?
That's another connection.
John and Rodney, huh?
Yep.
You know, when we talk about the proper way to wear masks, you see so many people with masks and they have the nose out.
Right.
I mean, it offends me, but
Yeah,
I don't.
me
I,
too.
nowadays, when you talk about it, you might get in a fight. But anyway, that's problematic because what's the point if you got your
Yeah.
nose out?
Right, right.
Yeah.
Dr. Callendar, I remember the time you said you spoke to someone in the grocery store about not covering their nose and how insulting they were.
Right. Right.
I went into a party store and every single employee in there, nobody's nose was covered. Just
Really?
out. And I started to say something to the manager. And then I remembered what happened to you when you were in the grocery store and spoke about not wearing their mask correctly. So just to avoid conflict, I decided to leave all of them alone. Probably will never go back in there. But nobody in that whole store that was an employee had their nose covered.
Yeah. See, I'd have to say something because that's not right. That
Then I'll
is
call you up and
dangerous.
I'll take you into the store.
Well, the other day I just went into Target and they sent me a survey and everything was fine, but I put a line. It was like, anything else you want to include? And I told them, well, all the employees have on masks, but all of them don't have over their nose. I said, so it's not protecting them or the customers coming in. Then
That's
of course
right.
they
That's
asked for
right.
my number and I said, no, I ain't giving my telephone number. But I did tell them, they need to make sure their nose is covered or what's the use?
That's well spoken. Well spoken.
Yeah, that's right.
I don't go.
But you're right. People get very offended.
Yes, they do.
Mhm.
Yeah, when I do go out 2 or 3 times a week to the grocery or to the car dealership service department, I make it a point to jack up everybody I see who's not wearing their mask correctly.
But see, Darryl, how tall are you?
6'2".
Yeah, well, I mean, it's harder.
Yeah, I'm 5'7", and I go out walking. I've been walking like 4 times a week, 5 miles, 5.5 miles.
Wow.
And I come into contact with a bunch of people, and most of them are this complexion, right? And a lot of them still haven't got the message about wearing masks. Most of them do, I think, have the mask on, but a bunch of them don't. So I cross the street or walk in the street,
Yeah.
with traffic, stay away from these people.
Yeah.
And, it's almost like I can tell the Republicans from the Democrats.
Yeah. Yeah.
Which is which, John?
I think the Republicans.
Yeah.
The Republicans consider it social, not social, but personal, a violation of their individual rights. Somebody to tell them to wear a mask.
Yeah.
Yeah.
It's idiotic.
Yes.
To me.
It is. But they're following the president.
Yeah.
The role model. He's their role model.
Right.
Yeah, I made a quotable statement the other day. I said, not voting is as bad as not wearing your mask.
Right.
That's interesting.
Yeah.
Yeah. Wow. Yeah, especially today. It's right.
Right.
This is probably one of the last ones. We're gonna have to do a lot of these next week, but because it's getting close to the time. But this is something that the observation that obesity does exacerbate a coronavirus infection, and since more than 40% of the Americans are overweight, this becomes an issue. And of course, as you know, obesity is associated with increased kidney disease, diabetes, and the list goes on. But this association with COVID is something that has been observed, and it's dangerous.
I was reading where 51% of Black Americans are obese.
Yeah, over 45. Yeah, that's right. which is scary, that you stand alone, Darryl, with your BMI. Yeah, because when you look around and you see people, you recognize that most people that you encounter are overweight. Actually, overweight is not it. They're talking about obesity, which means more than 30 BMI. Overweight is between 25 and 30. Yeah. And the whys are interesting. Why should you immunity have anything to do with it? But for some reason, it's the case.
Has something to do with your immune system. When you're obese, it probably predisposes your immune system to lower.
Yeah. The question is why though. Yeah, it is.
And when you look at Europeans and Africans and Asians, the rest of the world, the rate of obesity is so much lower. You don't see many fat people walking around.
That's true. That's true.
And they're home eating.
Yeah.
You're right. I went to 8 cities in Asia, and everybody was thin.
Yeah.
Except for the sumo wrestlers, but everybody else is walking the street. We're all thin.
Thin. Yeah.
But you just hit upon it. They were walking. They were.
Yeah. They don't have cars and all that.
Fitting.
You're right.
That's
Yeah.
But
you didn't see the fat people. They were home eating.
the American diet is the worst.
Okay, our diet, and then moving.
Yeah, okay. I think maybe we can do one more and then we'll call it a day, okay? Now this is a article included because the medication that they talk about that raise dementia risk are commonly used. We talk about benzodiazepines, which are anticholinergic drugs, which are commonly used drugs. And to find that benzodiazepine, but that's a name that may not connect with you. But when you talk about Valium and those anti-anxiety medications, just about all of them are benzodiazepines. And then when you talk about other conditions like GI diseases and Parkinson's disease, most of the medications that they give you for that are anticholinergics or benzodiazepines. And so these are common drugs, and that's kind of a little scary.
They seem like they're on the pain relieving side.
Well, those are not pain relieving medication. They're anti-anxiety medications. And then they also, the anticholinergics are for people who have GI problems and who have dyspepsia and acid reflux. And so these findings make you concerned. It's interesting how so many, I guess there's no drug that doesn't have any side effects, but just about anything else you want to take has got side effects. One of the things that is interesting to me in this article, they don't really point out which drugs actually that we commonly use are dangerous. I know what they are, but I think one of the things in this audit, and they may have not pointed them out because of afraid of being sued by the drug companies, but people take medications for anxiety, for sleep, for acid reflux. Have to be concerned about this.
Okie dokie.
Dr. Callendar, I know when I was taking care of my mother, and because she came to live with me because of dementia, but I realized that after she stopped taking all that medication and found a physician that took away mostly all that medication, she began to improve. So sometimes, and remember the doctor that you brought in for us, geriatric?
Obesity-san.
He was saying the same thing, that elderly doctors are prescribing too much medication for elderly patients.
Yeah,
Very true.
that's
Very
true.
true. Very true. Okay.